A 24-year-old female presented with painless gradual, progressive diminution of vision in right eye noticed since 1 year. The presenting best corrected visual acuity was 4/16. On focal slit lamp examination after dilation, there appears circumscribed circular bulge in the posterior capsule. This bulge is more evident on the anterior segment OCT, illustrating outpouching of the posterior capsule along with some vesicular changes in the cortical fibers around the cone. The systemic examination was normal, thus the diagnosis of posterior lenticonus was made. Posterior lenticonus is a rare developmental abnormality causing a progressive localized conical bulging of the posterior capsule, resulting in abnormal shape of the lens. So now, does the patient need surgery? Eye trace is a fancy tool which precisely depicts the quality of vision as well as helps an ophthalmologist to analyze corneal and lenticular aberrations separately. The eye trace map of this patient shows objectively the visual symptoms reported by the patient as well as a low DLI, that is dysfunctional lens index of 0.89, showing significantly abnormal functioning of the lens. The Chang analysis of the eye trace also confirms that the increased aberrations of the total eye is due to high internal aberrations. The quality of vision as well as contrast sensitivity is shown by modulation transfer function as well as Strehel ratio, which is 0.076 in this patient. Thus, the low Strehel ratio as well as the low MTF curve depicts low contrast sensitivity. Thus, the patient was counseled for cataract surgery. And phaco plus intraocular lens was planned under topical anesthesia. Intraoperatively, as we can see, an eccentric cone can be visualized. Standard phacoemulsification was carried out with very careful capsulorhexis, as the capsules are very thin and fragile and have a tendency to run away. A careful hydrodelineation was carried out with absolutely no hydrodissection. The phacoparameters were kept low during phacoemulsification to prevent shallowing of the anterior chamber. An important sign visualized here is a rudimentary stalk attached to the cone of the posterior capsule. The presence of this sign is considered as one of the proposed mechanisms for the development of posterior lenticonus. The theory suggests the traction of the posterior capsule from the remnant of the hyaloid artery, although the exact pathogenesis is still debated. IOL was thus placed in the bag. After removal of the viscoelastic, posterior capsule folds can be seen, showing laxity of the bag due to the posterior lenticonus. Post-operatively after 1 week, the vision improved to 6/12 with an absolutely centered IOL in the bag. Anterior segment picture as well as the anterior segment OCT shows folds and the posterior capsule. But what about the quality of vision? Yes, of course, the eye trace shows improved dysfunctional lens index with decrease in internal aberrations, with improved Strehel ratio of 0.46 and a higher MTF curve, implying highly improved quality of vision and contrast sensitivity after phacoemulsification and IOL implantation. Thus, the combination of surgical precision and advanced modern technology like eye trace is truly revolutionary for a successful outcome in patients of posterior lenticonus.